You operate 51 hospitals across the country, more than 1,000 clinics, 7 states, not including New York, but in Washington and in California, early sites of the outbreak. Just paint the picture for us, what you're seeing inside these hospitals and just how badly the disease is wreaking havoc.
Well, I think there's some good examples here. So we started with our first index case. Now it was 2 months ago, January 21st. The minute we had that first case, we started getting ready. And we started knowing what was coming and really getting organized. So what we knew is that if you can keep the rate of rise of cases, particularly coming into the hospital, you can get in front of this, be able to treat patients well. And so far, that's what we've seen on the West Coast. So we really got our systems ready. So we haven't seen these massive overloads. We've seen a steady progression. And for over at least the last 5 days, we've seen the same number of cases on a day-to-day basis, and we're hoping we're starting to see a decrease.
Now, you have a model predicting 80,000 to 100,000 deaths in the United States, which is actually less than the model that the president is now looking at, 100 to 200,000 deaths. How are you coming to those numbers and why the discrepancy?
All of these models are a little bit different. The models get better as you put more data into them. So, it gets more intelligent once you start to see what actually is happening. The models that we're looking at are predictive if everyone did what we're doing on the West Coast of really practicing social distancing, and it assumes that you're doing all the things right. So that could vary. I think the question to ask is, we'll know more within the next week or two which way it's going to be, either on the lower end or on the upper end. But the key is for everyone to kind of stay in place, do all the things that we're talking about. And we're hoping that we're right, that it's going to be on the lower end and not on the upper end.
That's the thing, though. Not everyone is going to do everything right. Florida only just issued a shelter-in-place order. Some models aren't predicting infections peaking until August. So how long do you expect that we're going to have to be under quarantine? How long till life returns to normal, if it ever returns to normal?
Right. Well, what'll happen is I think this will happen in waves. So there'll be parts of the country that get through the wave and then start to improve. There are others that are going to be later. And there's actually some predictive modeling, depending on where you live, where that wave will be. The tricky thing is once the wave subsides, so let's say in Seattle, it starts to subside, we start to see less cases, then there's also an art to how do you turn things back on? Well, you don't just flip a switch and start going back to business as usual. You turn the switch slowly. You start to bring some things back online, but at the same time, you do a lot of testing. And that's what we learned from Korea. So as they turned things on, they started really testing and making sure the disease wasn't starting to spread again. And that's what we're going to have to do as we turn things on. So as we do that across the United States, it's not going to be the whole country at the same time. It'll be parts of the country, different places. But the turn on also has to be done really, really carefully. And we can't just all of a sudden say, okay, let's go out and party and get everyone together. You start to ease up slowly, but at the same time, you do a lot of surveillance.
Speaking about China, I know you've been talking to medical professionals there to help you learn how to best respond here. Bloomberg has reported that U.S. intelligence has said that China has massively underreported their numbers. What is your assessment of the real situation in China? I mean, we're talking could be 10, 20 times worse than.
Yeah, well, the thing that we've really gained, doctors and scientists across the world actually like to talk to each other. And we're incredibly honest about what works and what doesn't work. So what our Chinese counterparts, and we're actually having grand rounds here on the West Coast with all the Chinese physicians, they've really been telling us about, honestly, what happened with it, what did they do that helped patients in the hospital, what didn't. So we're not getting into as much of the numbers and all of the politics of it. We're really talking about the science. And that's really been helpful to us in terms of how do we manage someone in the ICU? What are kind of the things that they learned about getting people off ventilators? Like one of the things they told us, don't wait to intubate a patient. If you think they're going downhill, get them on a ventilator sooner than later. You're going to save their life if they do that. So there've been a lot of practical things that they've been teaching us that our clinicians have been putting into play right away. So from a scientific basis, we try to avoid the politics and think more about the best care.
Speaking about the practical things, as I understand it, they communicated with you that masks weren't enough. You had to wear helmets. You have to wear face shields. This, as the CDC is considering recommending everybody in public wear masks. Is that something that you think that we need to do?
Well, I think it depends on where you work. So what they were commenting on, they were looking at pictures of our ICUs, and they said to us, in your ICUs, in those heavily trafficked COVID places, your clinicians have to be covered. You've got to make sure that they are covered with helmets and they have all the protective gear they could have. What they have also said, masking the general public is really to help prevent spread. It's not to help you not get sick. It's that you don't spread it to other people. And I think it's just been uneven. So we've gone to universal masking in our hospitals. But now the issue is, should the public itself, should everyone go out there and put a mask on? And yes, but what we're really worried about is it's going to take supplies away from our frontline caregivers. So we've got to be really careful about how that happens. They don't need hospital-grade masks to prevent spread as you're walking around. So that's something that we're trying to inform our public about.
Now, this is such a lonely disease for the people who have it. And then you have 120,000 healthcare workers who are on the front lines of this. How are you dealing with that? How are they holding up? And really, how dangerous is the situation for them?
So the thing that keeps me awake at night is worrying about our caregivers, because they're going in every day, taking care of patients. So we put some things in place for their psychological stress so they can know where to get help. We've been very transparent with our caregivers about how many people are getting sick or not getting sick. And we also want to hear from them. So we had a really open line of communication with our frontline people to understand what the issues are out there, what stresses they're seeing, and what they're frustrated with. And that's helped us a lot because this is the length of time that they're having to take care of patients and whatnot is what worries us the most. And then how do we support them in the best way possible?
So how are you doing on PPE? We're seeing states fighting over PPE, getting into tiffs with the president. Now Amazon saying all the masks they get, they're going to be donating to healthcare workers. What's the situation really like on the ground?
So for us, we could always use more. I mean, and I don't think there's one group of providers that say that we got enough, we're all set. But what we've been trying to do is we've been sourcing for well over 2 months and kind of looking all around the world for where we can get equipment. We're also in 7 states. So we're trying to see where are the hot spots in our 7 states, where are the needs, and how do we coordinate supplies across our own system. Every time we get a tip on someone on supplies, we feed it into a central supply bank. So we source from all over. We really have started to get into the whole idea of reuse, like reprocessing masks so they can be used again. So we're trying to hit on everything that we can. And in general, our attitude has been not to rely on the federal government and say, okay, that's a nice to have if we can have it, but we've got to figure this out on our own.
So what does this mean for you financially? You're the 3rd largest healthcare system in the United States by revenue. You make your money on elective surgeries, which aren't happening right now. Just how big will your losses be?
So that curve that showed the stock market over the last 2 weeks, that's exactly how our revenue curve looks. Our revenues are down 50 to 80% from once we started. So it's actually looking at our cash flow. We've been spending a lot of time making sure we can secure cash flow. So we got together with banks early, and we've gotten together, with some of the companies that we do business with to ensure that we can keep the cash coming so we can pay our caregivers, pay for the equipment, and do all the things that we have to. Meanwhile, looking at all of the federal things and the bills that are there. I worry about what the health system's going to look like in 2 months across this country. As a chair-elect at the American Hospital Association, we've been talking to a lot of the other members out there, and we're wondering what are the effects on particularly smaller hospitals, rural hospitals, and how are they going to come out on the end of this?
Now, the infection, as you mentioned, it's going to surge, and many people will get sick and not die, but still have to fight this. You've been having success getting patients off ventilators quickly. How optimistic are you about treatments and vaccines? How quickly will we see successful treatment and successful vaccines coming to market?
So the best thing, great care, not even thinking about treatments, which means getting the right people in the hospital at the right time, doing all the supportive measures possible, caring for people in their homes. So all of those are what I would say the basics. In terms of treatments, so I can break those down for you, very, very simply. There are a whole bunch of antiviral agents. So what happens, certain folks, whether they're young or old, get really sick. And this has to do with an element called cytokines in their lungs that basically fill their lungs up with fluid, do a whole bunch of things that they shouldn't. So there are a whole bunch of biologic agents that block cytokine production in the lungs, which really helps patients that are going downhill and really are risking death. And at least we have about 4 or 5 trials going on in our own health systems. Those elements seem to work well, particularly in turning around patients that are critically ill. The second group of agents are for those patients that are not as ill, and we've heard a lot about hydroxychloroquine. I'm a rheumatologist, immunologist. I've used that drug for 30 years. Those seem to be helpful in less sick but hospitalized patients, not for folks just to take it home, but we're doing trials with that because what we have to do is look at all the data because we don't have all of that information. And then the third area is a vaccine. And as Bill Gates talked about, I just wish we would have spent a couple of $1 billion on really understanding how to make vaccines quickly, because we have to have technology that can get us a vaccine in 3 to 5 months versus 18 months. So those are the different areas, those are the core areas that are really the fight against viruses that are out there. All of them hold some promise, but until we have a vaccine, we won't be able to kind of shut this down completely.